So the speakers we have with us today include a gentleman by the name of Padmore John, Dr. Raji Ayenla, Dr. Adrilia Allen, and Dr. Rosa Nuvini. Let me tell you a little bit about each one of them. Mr. Padmore John is the Assistant Commissioner for the Harlem Bureau of Neighborhood Health at the New York City Department of Health. He is chair of the Health Committee at the Georgia, I don't know what state I'm in, at the GHCC, and he works on addressing health equity and has been a Harlem resident himself for over 30 years. Yep, give it up. That's cool. That's fine. Yeah, might as well come on up. Come on up. How you doing?
I'm right there on the Edgecombe, so I'm right here.
Okay. I ain't gonna tell you where he lived, but he used to be a neighbor. That's what he said. Look, I can tell them where I used to live, but I can't tell them where you currently live. You're gonna have everybody pulling up at your house. Joining him are Dr. Raji Ayenla, Interim Chief Medical Officer and Chair of Graduate Medical Education at Harlem Hospital Center. Let's please give it up for Dr. Ayenla. How you doing? Pleasure. And next, Dr. Adrilia Allen, Executive Director of Clinical Trial Patient Representation at Merck Research Laboratories. Dr. Allen, ladies and gentlemen. How are you? All right, looking bright and beautiful in that outfit. I love it. And last, and of course not least, Dr. Rosa Nuvini, Breast Medical Oncologist and Medical Director of the MSK Ralph Lauren Center and Mobile Health Unit. Dr. Nuvini, how are you? How you doing? Oh, nice to meet you. Big, beautiful smile. All right, so you got some really powerful energy. You got two handsome brothers that I know what they're talking about, and these two lovely ladies who are obviously high-level experts in their field. So, thank you.
Thank you very much. Another round of applause for Lamont, Mr. Rucker. Hopefully he's still in Harlem. And bigger round of applause for all of you. Thank you so much for staying here. Thank you so much for giving us your energy, and thank you so much for giving us your ear. We have a pretty powerful panel here today, and we definitely want to hear all of the great information that they will be providing from quite esteemed institutions here in Harlem, here in New York City. I'm going to start with you, Dr. Ayenla. If you don't mind introducing yourself, giving us a little bit of a background on some of the work that you are doing at Harlem Hospital.
Good afternoon, everyone. My name is Raji Ayenla. I'm the interim CMO at Harlem Hospital. I've been at Harlem Hospital for 16 years. Prior to this role, I was the chair of the Department of Medicine for 9 years. I've been at Harlem for 16 years. Previously, at North General Hospital for 14 years. So all in all, 30 years in Harlem. Now, as you all know, Harlem Hospital is one of 11 hospitals in the New York City Health and Hospital Corporation system. We're the largest public health system in the whole of the United States. Some of the services we provide at Harlem is emergency services. We're level 2 trauma center. We have primary care services, specialty services, surgical services. We have a bariatric center of excellence. We also provide other services, including chronic care management, and a number of other services. Our goal is to provide the highest quality service for the Harlem community, regardless of their ability to pay, their immigration status, or socioeconomic background. Thank you.
Thank you, Dr. Ayenla. I think everyone knows where Harlem Hospital is, 135th and Lenox. You have seen the investment that has been made in the space, how it looks beautiful. And the staff is definitely on point. Services are on point. So we are very proud to have an institution like that within our midst and the work that they're doing. I will turn it over to Dr. Allen from Merck. I know there's a lot of good stuff that you all are working on. I think it'll be really important for us to all hear about it. Please, Dr. Allen.
Sure. And good afternoon. And again, I must say that I am very impressed by every one of you who are in this room. It says a lot about what you have prioritized for yourself and to spend a day dedicated to learning more about how you can live a life of wellness and health. So again, kudos to you, and also kudos to Black Health Matters for sponsoring this event. And I'm Adrelia Allen, Executive Director of Clinical Trial Representation at Merck. And I'm a pharmacist by education. And simply put, what my day job is to ensure that in our clinical trials, we have patients that look like you and me. For a long time, clinical trials has not represented every patient, and specifically in the US. And so I work and lead a team that is focused directly on that and making sure that our clinical trials are representative of the patients that are impacted by the disease. And so as we are working to do that, we're focused on making sure that we're making information available, because information is powerful, and if we can provide the information about clinical trials, we are empowering you in the community to be able to make the best decision for you and whether or not that clinical trial is for you, and working with your healthcare practitioner to make those decisions. And so as we work to make sure that our clinical trials are representative, we know that we will bring the best of medicine to all communities. As you've heard earlier in some of the presentations, specifically from Dr. Collins, and talking about for the Black communities, and as we know, we need to make sure as drugs are developed that they are safe and efficacious for not only for us, but for all patients.
Thank you, Dr. Allen. I cannot say how important the work that you're doing is, that Dr. Allen is doing. Maybe 20, 30 years ago, having a clinical trial that has a significant number of African Americans was unheard of. And because of that, there is less capability and access to medicines that come from these clinical trials. There's less decisions on how to improve our health outcomes. So it's good to know that Merck has made that investment, and we do know that there's a history in this country of taking advantage of the bodies of African Americans, and so being able to do that in the appropriate way is really important. Informed, full transparency, and the ability for us to know exactly the impact it's having on our bodies. So we appreciate that. Dr. Nuvini, I'll come over to you. We know that Memorial Sloan Kettering has been in the Harlem community for quite some time, and that right outside there is a mammography van that you all have here regularly. Tell us about some of the work that you are involved with, a little bit of your background, and some of the services we can expect from MSK.
Sure. Is this working? Okay. I just want to echo how impressive it is that everybody is here today, really standing up for themselves and their family. And it's such an honor to be here amongst everybody and the panelists. So Memorial Sloan Kettering, not sure if you guys have heard about it, is a premier cancer center that's right here in New York City. We also have a clinic up in Harlem on 124th and Madison that is specifically focused on cancer prevention. So Memorial Sloan Kettering at large is a cancer center, and our mission is to end cancer for life. And our mission at the Memorial Sloan Kettering Ralph Lauren Center up in Harlem is to prevent cancer in the first place. We also have a mobile health unit that is our clinic on wheels, where we do some screenings. We do some colon cancer screenings with FIT testing. We do prostate cancer screenings through PSA. And very importantly, we do a lot of education. A lot of people aren't aware that they're eligible for screening, that they've reached an age, or that they have a very significant family history, meaning mom, dad, cousins, aunts, uncles, siblings have cancer, and maybe that they need to be screening for breast cancer or colon cancer and such at an earlier age. So what we focus on at the Ralph Lauren Center is we want to make this screening very accessible. We have breast, cervical, colon, lung, and prostate cancers screenings on site, and we see everybody regardless of insurance status, because we believe everybody has the right to prevent cancer from ever happening in their lives and their family members' lives. We have patient navigators on site that can help people sign up for insurance or enroll in the Cancer Services Screening Program, which is a New York State program that helps cover certain screenings for uninsured or underinsured individuals. There are a lot of resources out there that I wish every single person knew about, because you can get very high quality care at probably most likely no cost to you. And additionally, what we do at our screening center is we educate people. We educate people so they can go back into their communities and actually talk about what screening is and what genetic testing is, what nutrition is, why certain foods are good for you and why certain foods are bad for you.
Thank you, Dr. Novini. So the key focus that we're going to be discussing a little bit here today, together with the fantastic services that are provided by these institutions, is the threat that has been made by the federal government making the decision of passing H.R. 1. The commissioner of the New York City Department of Health, Dr. Alistair Martin, he spoke about this, the impact it has, right, or the possibility of the impact it can have on our health outcomes. So we want to have a conversation to discuss the various ways that these institutions are making sure that some of the services that have already been discussed and others that they will be talking to you more about, how we can make sure that this is still accessible, what are the things that they're doing to make sure you're able to walk in through the door, whether or not that insurance does occur. We at the Department of Health is going to be making every attempt to make sure that no one loses their health insurance and their health access. But we know that sometimes things happen. So as I said, seeing that mail, for not being able to respond appropriately, whatever. But just because that has happened doesn't mean you should not get top-notch health care, right? So we're gonna go into this a little bit, but we also want to make sure that you have the information so that you can navigate these spaces and make sure that you have access to that health. So Dr. Ayala, in reference to Harlem Hospital is a safety net hospital. It's a hospital that's right here in our community. And it already does a lot in terms of making sure that folks can get access to care regardless of the capacity to pay. What do you know that you can share with us that they will be doing, Harlem Hospital will be doing, in terms of ensuring that H.R. 1, the implementation of H.R. 1 starting January 1, 2027, does not impact access to care?
Well, what is happening fortunate, because for many years we've tried to expand access, and we made sure that everyone who is eligible to be insured is insured. Now, what we do understand that this is going to cause a lot of disruption. Our goal is to minimize that disruption. 45% of our mix is Medicaid. So what we're doing is trying to prepare our primary care physicians to reach out to our patients and prepare them for this situation. We also believe that 50% of our patients are eligible for waiver. So what we're doing is having our doctors begin to prepare waiver letters for patients who qualify for waiver. In addition to that, we have New York City Health and Hospital has created a hotline where folks can call in if they are at risk for losing their insurance or are eligible for insurance and are looking to enroll. Anyone whose insurance is about to expire can call this hotline and begin to prepare for renewal. The hotline is 1844 NYC, the number 4 NYC. I repeat, 1844 NYC, the number 4 NYC. Now we have financial counselors on the other side who will help you navigate this insurance maze. Thank you.
Yeah, give it up. That's important. I hope everyone got the number 1844 NYC 4 NYC. All right, it's pretty simple. Make sure you do use that number if you qualify, if you are at jeopardy, if there's any issue that may arise that may prevent you from being able to utilize or continue having access to your health insurance. Dr. Allen, it would be interesting to hear what Merck does. We know that Merck has been trying to increase access broadly. There are a number of factors that we know that can influence whether people are able to connect with healthcare resources and opportunities. So can you just tell us about what some of the things that Merck is considering to increase awareness and understanding of the clinical trials in this capacity?
Yes, and sure. But before I answer your question, I really want to engage with the audience, and just by the show of hands, how many in the room do know what a clinical trial is? Very good, very good. And making just a little bit more challenging, what is the percentage of Black participants in clinical trials in 2020? If you think the percentage is greater than 20%, let me see your show of hands. If you think the percentage was less than 10%, let me see a show of hands. Y'all are very good, and well educated. And absolutely, you know, when we look at the bigger context of this, in 2020, the Black participants in clinical trials was 8%. However, Black patients or Black residents of the U.S. make up 14%. So you see that there's a big gap there when we look at the percentage of Blacks in the U.S. compared to those participants in clinical trials. And so that's why representation in clinical trials matters. We have to ensure that the new inventions, the new medical inventions that are making it to your communities, we need to ensure that they have been tested in communities and patients that look like you and everyone. And so as we focus on that, our goal is really looking at how do we advance and increase access to the information about clinical trials. And as what we've been working on is developing a platform which is called Let's Talk Trials, which is available to the general public, where you can access videos, materials, there's information about demystifying clinical trials, making sure that you have the right information about what a clinical trial is and how you can leverage that information and and really empower you and your village about a clinical trial before anyone in your community or your village needs a clinical trial. Because what we've also learned and what is stated in the literature is not that Black patients or participants don't want to participate in a clinical trial, it's often because we have not been asked. And so if I could make my next question, how many of you in the audience have been asked to participate in a clinical trial? And actually that's pretty good. That's really pretty good. And so our goal is really making sure that everyone, Black communities, especially those in the historically underrepresented communities, have the information that is needed to engage with your healthcare practitioner to be able to talk about clinical trials and understanding whether or not a clinical trial is good for you. And my life's mission, as working with my father, who was just before being diagnosed with prostate cancer, was refusing care and delaying care because he didn't want to be treated as a guinea pig by his healthcare practitioners. I know what it looks like, especially because I've had a loved one that I had to work with in helping him to understand that there are patient rights that are enforced to make sure that patients are protected. And so if you go to, thank you, if you go to letstalktrials.com, you will be able to access videos, brochures, information, get answers, FAQs to the questions you may have about a clinical trial. And the ultimate goal is really to normalize clinical trials and making sure that clinical trials is not a last resort, but it's an option that it's included as part of your medical journey as you're working alongside with your healthcare practitioner.
Thank you. So do you mind giving that website again?
Yes, it's letstalktrials.com.
And just to tap into that a little bit, what do you think folks need to be focusing on, even if they go on that site, to make them feel much more comfortable to be able to say, yes, I will participate in a clinical trial?
Yeah, so I think a couple of things, and one of the biggest part is recognizing, again, that representation. We need to ensure that our clinical trials has every race, every ethnicity, our elderly 65 and plus, our women. I mean, it's hard to believe that clinical trials by the NIH was approved in 1993. That wasn't long ago, about 30 years ago, that where it was required to include women in clinical trials. And so we really have to do a better job in making sure that these novel medicines have been studied in all patients, and making sure that the scientists really understand the data that is being generated really does, we'll know what that impact is before the drug is made available on the market. And so knowing that you can see someone that looks like you, that is a part of the clinical research process, and there are more than me that is in this industry that is working to make sure that clinical trials is available for everyone, and also learning where are clinical trials happening in your community. That should be something that you should know before there's a diagnosis, because once there's a diagnosis, there are a lot of decisions that have to be made. There's a lot of educating about the disease, and I want you to already know I'm going to be prepared to ask my healthcare practitioner, is a clinical trial right for me? And to know where can I go to participate in a clinical trial.
All right, thank you. Dr. Navini, as we had already established, MSK is in Harlem. I have known about it since 2009, 2010, thereabouts, that I got to know about, and you all may have been in Harlem even before that. Can you let us know what are some of the key services that are being provided right now that some of the Harlem residents may not know about, that they can come to that space on 124th or some of the other places that are being provided that can really provide this subset top-notch care as we've been talking about?
Absolutely. So we pride ourselves on high quality care. We offer mammograms, and at the same time, we also offer diagnostic mammograms, which means if you come in and you have a lump that you feel, right away we can get you a specific mammogram for that lump, and we can biopsy you. Twice a week we have our biopsy person there. And we have walk-in hours, 8 a.m. to 4 p.m. You can walk in at any time. You actually don't need a referral. You can just walk in. So let's say you're going for lunch and you feel like getting a mammogram that day. You can come in and get that. We'll set you right up with one of our nurse practitioners who can do a comprehensive assessment for you, make sure that we're not missing any other eligible screening, and get you right in. The other things that we offer are cervical cancer screening, so pap smears. They are utilized to detect any kind of high-risk lesions that would develop into cervical cancers. We also have colon cancer testing. We have a card called a FIT testing card that you can take home and collect the stool and send the sample in, and then we can tell you whether it's positive, which would mean that you would be required to get a colonoscopy, and we would navigate you to that, or negative. We also have PSA testing, so that's for screening for prostate cancer. And we have lung cancer screening. So this is something that a lot of people in general aren't aware of. If you have a smoking history, we now have a test that it's a CAT scan that looks inside your lungs to see if you have any tiny nodules. Lung cancer is one of the most aggressive cancers with not many treatment options. So you want to catch it when it's curable. And so we actually offer walk-in for that as well as the other services. And we go the next step in, we offer taxis. We have Uber, we have Lyft relationships that we literally, as a patient walks in and says, I'm eligible for lung cancer screening, we can get you a same-day appointment at our site downtown in this on the Upper East Side. So we really want to remove all of the barriers. We also have people that speak Spanish on site, and we have interpreter services, so if there are people that speak to other languages, very easy for us to get the interpreters for you. A lot of our staff, they live in Harlem and the Bronx, so they're rooted in the communities and they understand our needs. And additionally, we provide nutrition services because nutrition is preventative. How you eat dictates how you live and how long you live. And so we find that very important. We have nutrition demos on site where we also give fresh bags of food very frequently. And in addition, we have navigation through financial issues and also insurance. So, you know, HR1 is going to be implemented soon, and we know a lot of people will be at risk of losing their insurance, and we can navigate them to programs like the Cancer Screening Program of New York State, which covers certain screenings free of charge for a lot of people that are uninsured or underinsured, and we can navigate to other things as well. Our goal is to make sure that everyone has access to high quality screening.
Thank you so much. I want to just dive in a little bit to some of the great services. What happens, or how does MSK support a Harlem resident who is facing a cancer diagnosis and worried about cost of coverage, and even how, to the point that was being made earlier by Dr. Allen in terms of getting into a clinical trial. So if you are unfortunately identified as with cancer diagnosis, what type of cost that may be associated with that MSK may provide support with, and how can someone get into clinical trial if that is the case that they are?
Yeah, absolutely. So at MSK, we have a robust social work and case manager program. And when patients call in and they have an appointment with one of our cancer doctors, we immediately make sure that they're linked in with all of the resources. And we do a deep dive into not just the health, but everything else in your life. What is your job situation like? How many people are you taking care of? What are the barriers to coming to clinic? Transportation is often a big barrier, and we just one by one go through everything to make sure we address it. I personally treat breast cancer. I have a lot of women, young women that have breast cancer and they have little kids, and they have to miss their job, and we have to figure out how we're going to manage not working and still making a living, paying rent, et cetera. And these are really critical things. It's not just the disease, it's the whole entire person. It's their network. Who do they rely on? Who can help them? And on the clinical trial note, it is standard of care. It is high-level care to offer a clinical trial when it's appropriate. It is not something that we are putting out there to just experiment. We are actually advancing the care of our patients and also science in general and making it better. All of the medications that y'all are on now were once a clinical trial. So we are big advocates of this, and we always emphasize how much of standard of care that is, and we make sure all of our patients, when appropriate, are given the option.
All right, thank you so much. I know we're getting a little bit short on time.
And Pat Moore, can I just share,
Sure.
add on, and we talked about the barriers, and those same barriers for a clinical trial. The clinical trial team is also providing solutions to help patients remove those barriers. Similar for transportation, there's often Uber or Lyft, receipts that are available, so you don't have to pay to limit that out-of-pocket cost, as well as looking at, for who's caring for the patient. In cancer trials, the patient is very sick, and getting them to the office for the visit, as well as caring for them after they've had their treatment. Someone is having to take off of work to be able to do that. And so we also look at how can we provide and support for those caregivers so that those companions that are also helping the patient through this journey. So there's a lot of work that is going to remove the barriers so that it makes it easier for patients to participate. For the underinsured, how can we provide standard of care? And we also then work alongside with that clinical research site, because there are resources in the community, there are grants that are available so that we can help that patient holistically from the beginning to end, and not just so focused, because we know they are more than just their treatment. They are often someone, a mother, a father, sister, and we have to be able to help those patients as we continue to provide them with the best care.
Whole family care, that's what I just heard. Whole family care, it's important for the individual. Important for the individual who has the disease, the cancer in certain cases, but also for the surrounded family to ensure that at least there's some amount of peace of mind so that they can come and get the care. Thank you so much, that's so important. Dr. Ayinla, what do you see happening in terms of the potential impact of the loss of access to care to Harlem Hospital, for example, if HR 1 does go through? What are there things that are keeping you up at night? I know it's been doing that for me. Can you just talk what the worst case scenario that you think may occur if this does go through as it may happen?
Well, this is all about patient. We heard from the previous speaker that lack of access can lead to delays in medical care, particularly cancer care, which could lead to increased morbidity and mortality. Also, chronic diseases like congestive heart failure, we heard about hypertension and kidney disease. All of these can lead to worse outcomes for the patients. We'll also see increased number of ED visits, mostly late stage of the disease going to the emergency room. By the time we admit these patients, the condition may be worse. What we're trying to do at Harlem Hospital is to be ahead of this, begin to educate our patients. Even if they don't have access to care, they don't have insurance, they should still come to us. Be proactive. Establish contact with your primary care providers. even if their insurance lapses. We have ways to get into care.
Thank you. So, regardless of the situation you may find yourself in, don't think you are alone. Harlem Hospital is going to be here to act as a way of providing that support that you need, the services that you need, and reconnection to care, very specifically for whatever challenge or medical issue you may be addressing. I know we're getting short on time, so I'm going to go to you, Dr. Allen, and ask for closing statements, but also just to speak to what are some of the things that residents, some of the folks right here can do right now to make that connection as needed to you in a very specific way. I know you gave out the website already, but in different ways to make sure that there's this ongoing connection going.
Yes. And so when I asked the question earlier about participating in a clinical trial, I'm going to challenge each of you who raised your hand to make sure you share your story about participating in a clinical trial to the people who are in your village, because the more that someone knows that you've already done it and you've participated, it really helps them to consider it and to empower them to get the information that they need. And we need to share more of those stories about us participating in clinical trials. And so that would be my first ask. And then my second is, continue to be an advocate for yourself and partnering with your healthcare practitioner, accessing the information on letstalktrials.com to be able to address if you have any questions or any concerns about participating in a clinical trial. Get those answers. Seek out where you can to find the answers to your questions so that we can make sure that we are represented in clinical trials. And as these new novel medications come to your community, you will know that they have been tested in patients that look like you. And so that's the thing that keeps me up at night is, if we don't have the information, how can we make a difference, or how can we, do what is best for us? But I honestly feel once we know, then we can make the decision if a clinical trial is for us or not, but it's the access to the information. So please do take the time and access letstalktrials.com to be able to get your answers and your questions answered.
Thank you. Dr. Novini, thank you. That's really important. If you don't mind, for your closing statement, similarly, what do you want us to walk away with from here?
Absolutely. So cancer screening detects cancer at a very early stage before it becomes incurable. And so it's really important that everybody ask the question from their primary care doctors or other people they trust, whether they're eligible or not, because we really want you all to live happy, healthy, and long lives so you can be here for your kids, your grandkids, your friends, your family, and everyone else. And the way to do that is really to get proactive about your health and ask the things that you're eligible for, because I've seen it over and over again where people have caught things early and we've been able to cure them. And then I've also seen the other side of what Dr. Ayala is saying, where people present to the emergency rooms with such advanced cancer and unfortunately they're not curable anymore.
Thank you. I will also like to leave you with one final information. If you don't mind, if you have the ability to take this number down, this is a number that is being provided by the New York City Department of Health so that you can get information about HR1, what you need to do, what you need, if you need a waiver. Dr. Yinnes mentioned about a waiver. The doctors are prepared to give waivers if there is other information that is required so that you do not fall off the roll. That number is 347-396-4705. 347-396-4705. Thank you, everyone. This is all the time that we have. Dr. Inina, Dr. Allen, Dr. Novini, thank you so much. We also like to extend an appreciation to the Black Health Matters crew, Deidre, Rosalind, everyone that has been doing so much work to make this thing happen. We've been having conversations about this for months, and she's probably been working before that. So it's a wonderful event. Thank you so much for being here, and I greatly appreciate your attention.